You're live.
Hi everyone, this is Danielle. Happy Saturday. We're in West Hollywood doing a few treatments for acne. So as you can see, she has some inflammatory acne. We just did a couple little extractions, so she's a little bit irritated, but we're doing a combination therapy to reduce the redness, to reduce some of the inflammation, to kill, in theory, some bacteria and kind of shrink everything down. We are going to be starting with Aerolase, which is a great treatment, safe for all skin types, which is a big plus. And then we're going to move over to Fractora, which is radiofrequency microneedling. That's going to penetrate deep into the skin, deliver heat into the deeper layers of the dermis, and really shrink down the oil glands and shrink down all the inflammation from the bottom to the top of the skin. And then we're going to finish off with Clear and Brilliant, and that's going to work a little bit more on the surface, smooth everything out, and fight some of the acne altogether. So she's going to be getting treatment for both active acne and acne scarring. So it's important to do a 2-in-1. You can see that she has some scarring that is pigmented, a little bit atrophic, just a few concerns. And with that, it's important that you address all of them in one. One thing won't normally cure everything. So the better the combination, the faster your results, the better the outcome. So we're gonna get started. Aerolase she's had before. It's very loud, but it's painless, completely comfortable for the patient. And so we're just gonna float over the area and deliver some energy to the skin. She's totally comfortable. We do a few passes. Do you feel it at all?
No.
So she numbed because our second and third treatment require numbing, but Aerolase without numbing is still absolutely the most tolerable treatment we probably have. Just a little warm if anything. And so this is our second round of treatment for our patient. And we were talking earlier, and she noticed a little bit of improvement afterwards. You know, some things kind of start to come back in. They're clearing out now, but that'll slow down as we continue our treatments. Everything is going to get better and better with a package. So the more that we attack those problems, the more that they're going to heal and slow down in their occurrence rate. The technology that this uses is micropulse, so it's very, very quick energy release in the skin. The energy lets go, or the skin, lets go of the heat so quickly that it doesn't have enough time to cause a pain response. That's why this is so comfortable and safe for all skin types. You can treat acne with it, you can do acne scarring, hair removal, rosacea, melasma, just about any skincare concern. It's a great addition to our practice.
Is there any redness post-procedure?
There may be a little bit of redness post-procedure, but most of the time, nothing noteworthy.
So this is great for all skin types? What about dark skin types?
Good for dark skin types. Any Fitzpatrick is treatable with this.
Can you apply makeup after this?
You can apply makeup. You can do this at lunch. You can do it in just a few minutes and be on your way. It's something that you can do weekly or every 2 weeks or monthly, depending on what your concern is. It's great for keeping acne at bay, just overall skin rejuvenation. It's quick and easy, comfy. This is a great addition because it targets so many concerns. To do weekly, just pop in. It's like having your face refresher. Just make sure that everything stays in line and nothing gets too crazy over the holidays. We tend to eat and drink and party a little bit more. Sometimes it shows in our skin, and to keep it as nice as possible, you can add in these sort of treatments. We're in our second pass, so I tend to do my first and second pass kind of cross-hatching so that there's a nice degree of overlap in the whole area. We're almost done.
How's your patient doing?
How are you doing?
Totally good.
Totally good.
Comfortable?
Yeah. Okay, are there any questions about Aerolase? No? Okay, so I'll be finishing up. I'm going to complete my second toss, and then we'll be moving on to our next treatment. Thanks, guys.